I know you did this one experiment within the last couple of years where you ate a bunch of apples. And this was a week long. I think you were getting around 100 grams of carbs a day. This was to influence your lipid panel. So talk about that period and what changes you noticed.
Yeah. So there is this, some of you guys may be familiar with my friend Nick Norwitz, who's been looking at this so-called lipid energy model. And, the lipid energy model postulates that if you are relatively lean and you're on a low carb diet, that your cholesterol will rise uh, in effort to basically meet the energy demands. Your liver is going to traffic more energy in the form of fat rather than carbs because you just don't have the glucose available to you. And the way to reverse that is by eating carbohydrates. And he's demonstrated quite nicely that if he ate 100 grams of carbohydrates, and he did it with Oreo cookies as just a joke, basically, because it's the most outrageous thing he could think of. Eat a bunch of Oreo cookies, watch my cholesterol went from 500 to 200 or some 300-point drop or something like that. I think he had like a 380-point drop or something like that in 2 weeks of eating cookies every day. So I was like, well, I don't want to necessarily do a bunch of Oreo cookies, but I'll eat some fruit. I don't mind that. And so I did the same sort of experiment. And so my carbohydrate of choice was just some fruit. And I think I used apples just because it was easy to kind of do that. There's hang on a second. And so the result of that was it didn't really, in fact, it didn't do much on my cholesterol because I don't really fall into this lean mass hyperresponder category in it because I wasn't that lean. I mean, I'm certainly not obese, but I'm not like shredded lean like that. And it didn't really impact it significantly there. There's another experiment I did which was interesting. I can talk about that next. But what I did notice is that, for the first 3 or 4 days, I felt fine. The apples didn't bug me at all. By about a weekend, my guts just started hurting. I was just like, this fiber or whatever's in the apples was just not making me feel good from a gut standpoint. I didn't feel miserable. And honestly, I felt like I did for most of my life. I had a little bit, I'd eat. I noticed my gut was just a little bit, you just feel a little bit. When I went carnivore, that all went away. I mean, that was one of the things that struck me 10 years ago when I first went carnivore. It was like, I don't even know my digestive system's working because I don't feel anything. I have no perception of digestion. It was like going from a beat up junky car to hopping into a European luxury car. Where's all the road noise? Where's all the bumps? And it was just like, it's like super smooth. So that was the reason I did that. I did it for a week, just for that reason. I don't think I've had any fruit since then. That was over a year and a half ago or something like that. There was an experiment where I did impact my cholesterol significantly. I was up in Canada, where you're from. I was up at Whistler. We were up there skiing. And I just, for whatever reason, I said, I'm going to check my cholesterol. When we got back, and it was my total cholesterol in US units was 154 milligrams per deciliter, which is considered normal cholesterol. It's actually, most doctors would be very happy with that number. And so what I did was I just kind of fasted for about 18 hours, and I also worked out. So what did I do? I didn't provide my body fuel, and I expended more energy by working out. I checked my cholesterol after that, and it went from 154 all the way up to 345. So almost 200, I think it was a 189-point increase in 18 hours. And the reason was because my body was, didn't have any carbs to traffic. It didn't have any glucose to traffic. So it's trafficking fat. And that's why I did that. So it's pretty interesting to see how dynamic blood lipids can be in the right situation. And so this is why when a person goes to the doctor and this still happens today, you go in and you'll have one lab value that's a little bit out of range or even close to out of range. And they'll say, oh, you need to be on this drug for the rest of your life. And I'm like, well, I could have came in tomorrow and the number would have been normal. And then you would give me a different answer. So I think that's a little bit, something that we have to kind of realize that. And my friend Dave Feldman has been talking about that for well over a decade when he first started noticing, hey, I could change my cholesterol 200 points in a day or two, which is, most people don't understand that happens, and it does.
That's a really important point. A lot of people put a lot of value in those numbers, and they can just change so quickly. Putting that aside, how much value do you put in a lipid panel? Say somebody's showing a high LDL, high overall cholesterol. How much of a concern is that?
I don't want to, and I've said this consistently over time. I don't think people should ignore, abnormal lipids, whether it's high triglycerides or high LDL cholesterol or whatever, and just say, well, I'm low carb, I'm keto, I'm carnivore, it doesn't matter. I don't necessarily subscribe to that belief system. I do believe it's multifactorial. I think there's other things that are more important. Like, for instance, diabetes, I think, is a much more important risk factor for atherosclerosis and heart disease than is your lipid number. The lipid number tends to be something that we can easily drug. And so that's a whole different discussion there. But so I use it as a red flag. If you come in your LDL cholesterol is 300-400, super high, you shouldn't just say, oh, put your fingers in your ear and say, I'm low carb, I'm keto, ignore this. I think it warrants further investigation. That might be some imaging, CAC score, maybe a CT angiogram, depending on what the results of the CAC score might be. And again, this is evolving science that we don't really know yet. I mean, there's a lot of data out there. I shouldn't say a lot. There is growing amounts of data out there that suggest that there are people with extremely high cholesterol that are at no increased risk of cardiovascular disease in someone with lower cholesterol. I mean, that seems to be being shown. And again, there's more data to come on that. And I think we're going to get another bolus of that data here in August, which will be interesting to see, and more to come on that. So I just tell people, and again, it depends on their age, and it depends on what else is going on in their health history and so on and so forth. And so, but again, there are people out there that says all about the triglyceride HDL ratio, and everything else is doesn't matter in there. I don't know that you can say that's safely either. I mean, I think it's important for sure. So it's a picture of things, and again, the imaging tells you what the deal is. I mean, it's like we're speculating and guessing based on these lab fluctuations when we could actually look and see what's going on. And I know the people critical of that are saying, what's a late indicator? Why not prevent this? And I don't discount the fact that if you get your LDL cholesterol or your ApoB, probably more appropriately to talk about, to the rock bottom floor, as low as it possibly can be, you're probably less likely to develop heart disease. Like if you look at the development of heart disease, is like, let's say we're going to start a fire and we need a couple of ingredients. We need something to burn. So we need wood. We need some fuel. So we would use oxygen as our fuel. And then we need a spark. We need an inciting event, right? And so the analogy would be, perhaps the fuel in this case, or the inciting event, is some sort of inflammatory damage to the vessel, and you need cholesterol as a wood, and maybe the fuel might be the glycemia or some other high oxidative situation. And so if you don't have any wood, if there were no, I mean, again, there's other things that burn, but if you had no wood out there, you'd be less likely to have a fire. So if you take your cholesterol down to basically zero, you're not going to likely to develop a lot of atherosclerosis. But the other analogy is let's just say I was really worried about having a sexually transmitted disease, right? And I decided, and I said, you know what? We can fix that by just amputating your penis. That probably would prevent you from getting a sexually transmitted disease, but there's some downside to that. So I think the same thing when we were trying to rock bottom out cholesterol. And I know the people out there that are advocates of that are saying, well, we've got, pharma studies that show that low cholesterol is no problem at all. And I am somewhat skeptical of that. I think for good reason. I think these companies have forever put out a lot of deceptive research. They've covered up a lot of negative findings. And plus there's plenty of people that seem to have trouble with tolerating some of these drugs. So we have to worry about that. So I think it's something that, let's face it, at the end of the day, all of us are going to die at some point. Many of us, irrespective of our dietary strategy, are going to develop heart disease. I mean, whether it's a vegan diet or a carnivore diet, still a lot of those people will probably develop heart disease at some point. It's just, you got to die something. It's like, if you live long enough, you're going to probably die of whatever. Many of them are going to get heart disease. So I tend to more focus on the here and now. And because I think a lot of it's just speculative. And I think it's to the point where I don't know that we will ever truly know for any given individual what the exact thing is. But we can take people that are sick and suffering and make that no longer so. I can take a person with severe autoimmune disease and likely improve them significantly, often just by lifestyle factors, diet, exercise, sleep, some of these other things, with or without drugs, and hopefully in many cases without the drugs, because the drugs often can come with a big downside, whether it's just, even if it's just a cost, the outrageous cost that many of these drugs are, but also the many side effects that are well known.
You mentioned this new data we're going to get in August. Where is that coming from?
Yeah, it's going to be coming from Matt Budoff's group out of UCLA. It's the same thing Dave Feldman has been looking at. They did their 1 year analysis, and they're running it through the various different what's the word I'm looking for? Different ways to evaluate the data. They put out initial data with something called Clearly, and there's a lot of controversy around that because it's data that no one's ever seen before. It's very brand new. There's only a couple studies have ever used it, in the extent that they're using it. And so when they're looking at the more traditional markers, when they're looking at, they look at something called IVUS, which stands for intravascular ultrasound, which has been used for decades to evaluate plaque progression, soft plaque progression. And so when they compare that more directly with that, what they're seeing, or what they seem to be seeing, and again, I think we'll have more clarity on the data that comes out in August, that these people on a ketogenic diet with super high cholesterol didn't really develop significant heart disease. In fact, it was probably in line with anybody else, but I'll let the data speak for itself, but that seems to be where it's going with that. So I think Matt Budoff's going to present that in sometime in August. So, we're mid-July now, so probably a month from now, we'll probably know that data. And then hopefully, and one of the biggest problems with that particular study is the lack of a true control group. And that will be because we're looking at historical averages and saying, what are average people in this age range with these risk factors? How fast do they develop plaque? And so they don't have a direct comparison. So I think that's going to be the follow-on study, if I'm correct from talking to the authors on that. So again, this data is evolving over time. I think we're going to know, in the next 3 years, certainly, more on this stuff, and it gives me more confidence as a clinician when I talk to people about this stuff that say this is what the data shows today. Because we've been so long practicing population-based medicine on disparate populations. If I say, we got all this great data on females, and then you're a man, and so we've had that argument made by the other way around. All this data is on men, and when we look at women, we're finding very different results. And so I think when you have all this data on people eating a Western diet, high carb, high grain-based diet, and then you put somebody who doesn't eat that way, completely different, in a completely different physiologic state, ketosis versus not ketosis, I think you have a lot of different outcome things that don't necessarily mean pathology. It may just be normal for that situation. And there's a whole bunch of labs that fall that way. And this is one of the reasons I tend to not fixate on labs as much as some other people do. I think it's, and I think my friend Rob Wolf from the paleo diet guy from years ago basically said, how do you feel? How do you function? How do you look? And I think those are the things that are clinically relevant for most people. Now, again, it's not to say that some people that look good, feel good, and perform good don't get sick. But again, that is the vast minority. It's kind of like when people point out, well, there was this smoker who smoked 3 packs a day and lived to 100. Yeah, but that's the exception. And it's the same thing the other way. Every once in a while, some super fit person will die early, and they'll say, "Oh, well, look," But you would say, well, how many overweight couch potatoes died early in that same time frame? And it's 10,000 to 1. I mean, it's not even close. So, I mean, it's to me, it's more about what's subjectively and clinically more important than any particular lab test for most things.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The last 9 years, I've probably consumed, without exaggeration, like 10,000 steaks. That was one of the things that struck me 10 years ago when I first went carnivore. It was like, I don't even know my digestive system's working because I don't feel anything. I have no perception of digestion.